All right, and welcome to episode 5 of Modern Prescription. My name is Dr. Deepak Dukar. I'm a facial plastic surgeon in Beverly Hills.
And I'm Dr. Jeff Toll, internal medicine / COVID hunter.
COVID hunter / McDreamy.
Well, thank you. Thanks for noticing.
McDreamy is the character from Grey's Anatomy. Very handsome, very, very handsome doctor. So today we're talking about some cool stuff.
Yeah, we're talking about how McDreamy picked his specialty.
Yeah, medical specialties, how we picked them, why your doctor picked them, and if you're thinking about medicine, how you can think about it.
I think it's interesting to hear really why people choose what specialty they do. It says a lot about them as a person.
Yes, and you can tell characteristically wise, personality, does it match them or not? I think most of the times it does, but sometimes it just
like if you're friends with a pathologist, you got to realize they chose a profession where they only deal with dead people. So you got to question that.
Yeah, they're not going to be throwing the funnest house parties. We're also talking about sleep and how important it is.
Sleep's very important.
Talking about meditation, you're gonna go into that.
Yeah, I'm gonna take a little bit of a dive into my meditation journey and how that's been so helpful for kind of restoring and getting my energy level up and getting me focused.
Yeah, I love it.
It's going to be a great episode. So
it's going to be a great episode. So thanks for listening, guys. Stay tuned. And today we have our first huge, amazing guest.
Are you calling D. Murthy not a huge, amazing guest?
No, he was a huge, amazing guest as well.
Second guest.
Second huge, amazing guest. Miss Arianny Celeste.
I'm very excited.
Amazing entrepreneur, has an amazing new company called the Girlfriend Box, where she has an amazing opportunity for patients, people, everyone around the world to get some really cool stuff sent to your home. She's going to tell us all about it. And then also, you know her from your love affair of UFC and fighting, right?
Yeah, I used to watch her on TV 10 years ago.
You're a big fight fan?
Yeah, I used to. I honestly haven't been following as closely the last few years, but in those days I used to watch quite a bit. I used to do some jujitsu actually.
Ah, cool.
So
many onions to Jeff Toll.
During those jujitsu days,
Layers, yeah. The jujitsu guy who's the McDreamy doctor who does meditation. This is a good episode.
Thank you. You're like filling out my dating profile there.
What we look for, we're gonna hear a lot from Ariana Celeste, UFC queen, and also pregnant, and going to talk to us about fitness and health and wellness during pregnancy.
Great episode, guys.
Stay tuned. Thank you. Today we're talking about a whole array of great topics.
These shows just get better, don't they?
Yeah, absolutely. I think we keep talking about cooler stuff, and the numbers are going up. So thank you guys for listening. Thank you guys for tuning in.
Appreciate it. Keep sharing the show.
Yeah, keep sharing, keep commenting, liking, and subscribe.
Yeah.
We're really happy. Spotify, Apple, everywhere.
So now that I know everything there is to know about this damn coronavirus.
COVID King.
As the COVID King, reigning champion.
Yeah.
I really want to know, I have one main question.
Yeah.
So we're testing, hundreds of people a day now.
Yes.
The most commonly emailed in question to the service after people have booked their house call before the nurse gets there is, do I have to let them stick the swab up my nose?
Yeah. Oh gosh. Yeah.
And since you are the reigning nose king,
yeah, that's right.
I thought you would be a good person to ask this.
Yes.
Why are people what is the phobia? Or do people have nose phobias?
I think so. And I think it's because the nose is so sensitive. Like the tissues inside the nose are so sensitive, and no one's ever been touched there. It's not like you're, anywhere else in your body. So you've never been touched there. It's also super sensitive. And so naturally the people doing the testing, there's no, even as a ENT specialist using endoscopes, and we do a lot of two-handed techniques. We use endoscope in one hand we use an instrument to suction or clean or to remove debris. And even then, we are navigating super gently and carefully, endoscopically looking the entire way. Doing it blindly, oh my God, you're hitting the septum, the turbs, the middle turb, you're hitting the airspace. I mean, all of those are so sensitive.
Do people know what a turb is? Do you want to explain?
Yeah, so a turbinate is a little ball-like structure in your nose. It's about the size of a finger. You have one on the bottom called inferior turbinate, and you have one above and one on the top. The inferior turbinate size of a finger is meant to warm, humidify, and moisten the air we breathe. It sometimes gets really big, and you can't breathe well if you have allergies or if it's dry.
That's the like for a non-ENT, when I look in someone's nose, nose, that's all I see, right?
Yeah,
is that
that big pink ball.
When it's good, it's pink, and when it's bad, it's like blue purple.
Yes, blue purple means allergies, exactly. But if it's nice and healthy, it's pink and small. If it's big, it means maybe some allergies. If it's bluish, it means definitely allergies. But yeah, that's the problem. That's the reason people are having a hard time with COVID test, is that. Plus, if you have a septal deviated septum,
right,
then those two together, it's so hard to stick a swab in the nose properly.
So anyone we try to swab that we have trouble getting up, we should probably refer to you to check out their septum?
There's maybe, if they also have breathing problems. I don't necessarily think they have to, but yeah, if they have breathing problems. But that being said, I do think controlled testing environments are better. I don't think ENT should be just wildly doing COVID tests, because that's not the goal, is to bring sick patients to healthy patients.
No, obviously.
Yeah, but no, I think the drive-through settings that have been created across the world now is super smart, because it's just so convenient.
Well, also the outdoor part of it is because outdoors there's less, it's safer for the staff that's doing the testing. So obviously they're protected. They have a mask on and a face shield. Right. Karen, not just a face shield.
Right, not just a face shield. Yes.
Both. But I think it protects them, as well. So
yeah. And NBA, looking at what they're doing too, because they're testing their players daily, it looks like.
Right.
Every single day.
Right.
So are they doing nasal swabs, you think, on these guys every single day?
I think so. Why? I still don't understand what's so terrible. It burns for like 10 seconds.
Yeah, 10 seconds.
Because I'm testing myself like every other day or every 3 days because I'm seeing so many patients.
Yeah. Do you do your swab yourself, or you have a nurse?
I've been swabbing myself.
You have been? Oh my God, that's crazy.
The first few times one of my office nurses was doing it, but I didn't want her to give the satisfaction of seeing my eyes tear. So I've been doing it myself now.
You always want to be the leader with your staff. Yeah, I love it. Yeah. Wait, so when you do it yourself, do you like topicalize or numb yourself, or you just
no? Just go up there and you give it a little twist-a-roo. The eyes tear, it's a little burny for a second, and then you're good.
Okay, I love it. That's amazing. Yeah, the NBA players I saw, they're wearing like these new rings. All the players are wearing the Aura rings.
Yeah, those are cool.
Yeah, and it's like temperature scanning them permanently, like basically scanning and tracking their temperatures at all times, which is kind of cool.
These devices are getting crazy.
Yeah, what do you think about these? I mean, there's lots of different ones. You were mentioning earlier about the one you can track your EKG on.
Yeah, there's all this cool stuff. I mean, nothing's tracking you quite as well as TikTok.
Yeah, that's true. The Chinese are winning the game.
But the medical devices are cool. There's the one that a bunch of them I use remotely. So I do a lot of managing of these complex, patients are at home where sometimes they really would be or should be in the hospital, but families that are able to keep someone at home, and have a nurse on staff at home, let's say.
Yeah.
So let's say you have, congestive heart failure, which normally if you have a little extra fluid, you may need to go in the hospital because your oxygen levels aren't as high. So we'll be sort of actively giving them diuretics from home.
Wow.
And we can have them kind of in real time checking their pulse. So instead of having them in the hospital, they're on a cardiac monitor.
Right.
But at home, basically the nurse puts their two thumbs on that. I get a little EKG reading. It gets texted to my phone, and I can actually see, are they in AFib now? Is that part of what? So we can use it. There's also a lot of Bluetooth, like blood pressure cuffs. Those are super helpful too. So for some patients, the old school day was you'd show up to your doctor, your blood pressure would be slightly too high, and your doctor would say, listen, I don't know if you're just nervous in the office or this is your real blood pressure.
Right.
Go write some readings down, and then come back, and next time we'll see what the blood pressure looks like.
Right.
They never bring in the readings. They forget, and then you have to guess or whatever. So with these the blood pressure Bluetooth machines, it sort of saves them and actually charts them on a graph.
Cool. That's so cool.
So you can even see, is it rising at night or in the morning? Should we change when they're dosed? Not the amount, like 5 milligrams to 10 milligrams, but is the problem this one should be at night or morning? And so you can get really, depending on how nerdy you want to get with it, you can get pretty good control of all these things.
Yeah. This is like the best kind of nerdy though.
Yeah.
It's like life-saving nerdy. So like the old school technique, like I remember even my dad writing his blood pressure down in the journals every day.
Yeah.
It's not necessary anymore. Just buy a modern day Bluetooth.
I mean, the thing is the elderly patients aren't great at using them a lot of times, so true. I think the, 80 and older crowd can't use them unless they have someone helping them typically. But it's cool. Yeah. You can actually, the clinician, the doctor can actually get a login to each person's account.
Wow.
And so cool. during a virtual visit with someone, when I'm checking in on them, I'll log into their thing and see what their blood pressures have been.
Yeah.
There's actually this type of thing for diabetics with sugars also. So I'm literally looking at a graph. It used to be they bring in like a blood-soaked piece of paper because they finger prick themselves, and right after the finger prick, they're like writing down the numbers.
That's amazing.
And now I'm actually seeing it on a graph, and I can tell, do I need to increase their nighttime insulin, or is it the mealtime that's the problem? It's really cool.
That's really cool.
This ring thing I haven't seen, but it looks cool.
Yeah, it looks cool. There's a couple other ones that are very similar. A lot of my buddies are talking to me about them. Dream and Whoop. Dream with 2 E's and Whoop. And they're like wearable devices that are mostly used for sleep tracking. Because I think that's like a new hot thing right now is tracking your sleep. I mean, insomnia is a huge problem for so many people. I'm sure you have lots of patients with that problem. And so sleep tracking. And I think it's more like, we all know, don't drink before you go to sleep. Sleep early, don't have television on. Keep your, light sensitivity low as possible. But sometimes I feel like having the reading in the app, it really helps you visualize what's so obvious. And I think that's really helpful. My friends who are using it love it.
Are these supposedly trying to register what type of sleep you're in, REM sleep?
Yeah, they're supposed to be able to study whether you're in, how many hours you're in each stage of your sleep, and more importantly, your REM sleep.
Gotcha.
Because that's your most restful. The amount of REM you're getting determines how much restful sleep you're actually getting.
It's amazing how little we really think about sleep as part of our health.
Yes.
And how ultimately really important it is, and how little we really know. We know some stuff.
Yes.
About how it's basically like when you, on an old school computer, like if you had a computer in the 90s, if you didn't turn it off and restart it, it would be slow and slower and slower and not work until you did it.
Yeah, and then your parents remind you, hey, once a week, turn the computer off.
Or whatever. Yeah.
No, it's so true. It's such a good point. And what you said was so cool because nobody knows how sleep works. Till today, we don't get it.
No.
We're able to go into this state of complete shutdown of all of our systems except our cardiovascular and our neurological stay intact somehow. And the same thing with drugs. We have a drug called propofol that we give when we do surgeries. Propofol, most infamously known for the drug that killed Michael Jackson, because used improperly, not because it's a dangerous drug. But when we give it with anesthesia, till today, they still don't know how it works. They don't know they know it works, but not how it works.
Yeah,
exactly. They know it crosses the blood-brain barrier. It has the lipid penetration. But what it does after that, they have no idea till today. They just know it blocks signals. But how does you block everything except for your cardiovascular? How does your heart know to work?
No. So it doesn't block everything. All your other organs, your kidneys are working, your liver's working.
Yeah.
It's really turning off your consciousness. It's not turning off your brain, because if you actually,
that's true.
If you do functional MRI studies when people are sleeping, there's certain pathways that are actually on overdrive from normal. So your memory consolidation, for example.
Yeah.
So if you're studying, let's say you're studying for medical school, you're listening to the show.
Yeah.
You need to sleep. So if you're studying all night and you don't sleep, that whole pathway, whatever you were studying, it's going around the whole night, laying down basically more neurons, more connections to remember that thing that you learned that day.
Right.
So if someone is taking sleeping pills, if someone is drinking alcohol to fall asleep, they're then wasting those first few hours of sleep without having that memory consolidation. There's also a lot of cleaning up of the brain that happens. So there's some thought that some of the various dementias are really that the cells over time are building up some toxins that weren't cleaned appropriately. Right. Some of that's genetic driven, like early Alzheimer's and things like that.
Wow.
But for people who are chronically not sleeping, they can also have a similar phenotype.
Do you feel so if someone, if you need 8 hours of sleep, right? And then you only sleep 6 hours, is sleeping 12 hours the fourth night okay? Because it kind of catches you up?
I think it's better than not doing that, but it's not as good as getting the full
8 every night or whatever your body needs.
There's some evidence actually that human beings are all meant to take an afternoon nap actually. So evolutionarily ancient humans, cave kind of guys and gals would actually probably take a nap after lunch. And that's why most of you out there, if you're working from home or at the office or whatever, 2 o'clock or so, you start reaching for a coffee or whatever, because you feel tired.
Postprandial.
That's really programmed into us.
Yeah, that's a good point. It's
because it's the peak of the sun probably. So like it was too hot. So it's like time to rest.
Yeah. Psychologically, that makes sense. Do you sleep 8 hours a night? How many hours do you sleep?
I pretty much do sleep 8 hours a night.
You do?
My sleep, unfortunately, sometimes gets broken from pages from the hospital, phone calls, at least 3-4 times a week, I would say. I get woken up at 2 or 3 in the morning.
Yeah.
And I'm not good at falling back asleep. I've gotten good at, I do some meditation before I go to sleep most nights. And that's really helped me over the years sleep a lot better than I used to.
Yeah. Self-meditation, or you use an app?
No, I do it by myself. So this is a whole nother thing. I really biggest believer in meditation. I think it's amazing for stress levels and anxiety, especially for people who are like really work hard and have like can't turn off. They're so focused on their business, their family, and then they just can't turn it off.
Right.
I started by taking in-person breathwork classes.
Cool.
And then slowly over time learned how to at least do that by myself. And then I've done the apps, mindfulness and other things. I tend to always come back to breath work, which means you basically are, instead of theoretically focusing on nothing or letting thoughts come in and pass out of you, I sort of prefer to focus on my breath. I'm focusing on something, but that breath is like relaxing me. Down.
I love it. Yeah.
And then, usually when I get in bed, I get just like my body's, if you compare it to like a volume, like I go from like a 10 on the volume to like a 4, but by meditating,
Yeah. So
what do? You're fast paced. You see patients.
I know.
Family, everything. How do you relax?
I don't meditate. I probably should. I'm going to have you teach me in a few minutes what you do.
How's your sleep?
My sleep's terrible.
Is it?
I sleep like 5 hours a night, maybe 6 most nights.
What time are you getting in bed?
I get in bed around 11:30, and I wake up by 5 to 6, depending on the day.
Alarm, or you just wake up?
I usually wake up in a panic, and then
why? What are you in a panic about?
I'm just always thinking and worrying, and I'm like that classic go. I just can't turn it on. So my wife, like, thank God bless her, like, will force me to like just calm and sit and think and relax. And my parents are the same way. They just get me to calm and relax. And I need that in my life. I need external people to help me. But meditation, I think it's so hard for most people to, and I'm one of those people who look at it like, oh God, I can't do that. Like, because we make it into this big process. So take us through, what's your like actual process?
So my take is that if someone intends to get in really good shape, if someone intends to run a marathon, or if someone intends to, you know what, I'm going to lift weights and I'm going to have a great body. I'm going to get in shape. They know the first time they go to the gym, it's going to be rough, and they're not going to be buff.
Right.
They're not going to be running a marathon, So if someone hasn't been doing anything for 10 years, if they say, I'm going to take up jogging, or I'm going to start, the Peloton or whatever, you have to realize you improve over time. Your endurance gets better. You get more used to it. Instead of being painful, you feel good after. Meditation's the same way. That if you do it once, you're not going to know how to do it. You feel like, oh, I don't get it. It's this. I can't turn my brain off.
Well, give us a 60-second.
The reason I liked breath work, like I said, for someone who has that type of mind that you can't turn it, you're just thinking about something, you can't turn it off. It allowed me at least to focus on something, which was the breathing.
And are you doing nasal breathing?
It's in with my nose out through my mouth.
Yeah, so very classic yoga.
Yeah.
Yoga's breath is life. And so it's very classic yoga
exactly.
breathing.
And I think the reason I maybe even learned to like the breathing was one of my ex-girlfriends was a yoga instructor. And I used to do yoga with her, and I would love Shavasana.
Oh, man.
And I would feel so relaxed all the time.
Yeah.
And then I think that is actually, now that I think about it, that's how I started doing the breath work.
Amazing.
But I had to go to classes, and there's like such an energy in a room. If you can, I know no one can do this because it's coronavirus, but if you go in a breath work class, you just hear everyone's stress melt away. Just that lion's breath. And everyone's, because you see that I think part of stress and anxiety is you feel like you're the only one who has it.
Yeah.
I think we talked about this a few episodes.
Yeah, it gets caught in your
Everyone
head.
has stress and anxiety.
Right.
Every single person listening to this.
Everyone.
And so we all need to like, you know, feel that there's nothing wrong with you to pursue these things, to go to a meditation class. It's like going to the gym, but
right.
But taking care of yourself in a different way. And then I think that for me leads to better sleep, and also more productivity. The
other night I had one of the best nights of sleep in my life. And the secret was I went to bed super early and my phone was in a different room. That was incredibly empowering. I never realized how this device psychologically really triggers us and really puts this anxiety on us because we're worried about what's going to come through this, what email is coming, what text is coming, what notification is coming. And when it's nearby, just psychologically, you pick it up and you subconsciously worry about it. So I just had it in another room. And I know not everyone can do that. You, when you're on call for your patients, you can't do that. And that's part of the process where meditation probably helps you. But for me, just having the phone in the other room, wow, it was so empowering.
So why don't you just turn it off every night?
Well, it's the same thing. So I'm on call 24/7 for my patients.
Yeah.
So I put it in my wife's. So I slept in the guest room that night because the air conditioning wasn't working in our master room. And so I left. She just doesn't care about the heat, so she could sleep through the heat. So I left my phone in her room. So I figured if a patient calls, she'll wake me up.
That's a great wife.
It's a great wife. I'm very lucky. My wife and I work together. She's my anesthesiologist.
Oh, I didn't realize. I think you maybe told me that when we first met, but I forgot.
Yeah. So my wife's my anesthesiologist.
Amazing.
We went to med school together. We went to undergrad together. And so it's really interesting working together. And we did not plan this. Like everyone's like, oh, was this your plan in high school? It's like, no, this just randomly happened.
Interesting.
So she puts all my patients to sleep. And
I know some other couples that are the surgeon and anesthesia. It's cool. Really cool.
It is cool because we have two separate worlds when we're at work.
Yeah.
It's like the pilot and the stewardess, or it's like the pilot and
don't say
the engine.
She's not going to like that.
No, I'm the stewardess.
Oh, gotcha. Okay. Just making sure.
No, I'm the steward. I'm making them feel pretty and making them have fun. She's actually doing some serious stuff.
So this is actually brings up an interesting point. A lot of people always ask how do you pick your specialty?
Oh, great question.
So how did you and your wife were dating and thought how cool would it be if I become a surgeon, you become anesthesia, or you guys randomly just picked those two? Or?
Randomly. She actually wanted to do ENT, facial plastic surgery first. So when she was a first year med school, that was like her thing she wanted to go to. And so she used to go to the interest groups. And, I was just kind of like, okay, that specialty seems kind of corny. I was definitely like gung-ho orthopedic surgeon.
Yeah.
Like I just loved that whole concept, like the guy's guy.
Yeah.
I grew up like that kind of mentality. So I was
You're a Texan.
I'm a Texan.
You wanted to saw stuff and hammer.
Yeah. Oh, absolutely. Shoot guns.
And now you're like the most delicate surgeon possible.
I know. I went from literally 1 to 100. And, but yeah, so I wanted to be an orthopedic surgeon, and then I shadowed a couple of facial plastic surgeons, and that changed everything for me because it kind of showed me the delicacy within it. Because one thing I saw with specialties and picking them is there's two like different main paths for me. One was like either really complex diagnosis and simple treatments, or really simple diagnosis and complex treatments. And I fell in love with the complexity of the treatment, which is surgery, right? Very complex surgeries. Because with what you do, a lot of times it's all the diagnosis, like House MD, right?
I've never thought of it that way, but that's beautiful how you say it. Yeah, I totally agree.
Because most of your work is the diagnosis part, and that's really difficult. Like it's not easy for you to figure out some of your most complicated patients, I'm sure. But once you figure it out, then sometimes the treatment paradigm is pretty straightforward.
Right.
And so that's one thing. I guess the diagnosis, you have to be really smart to do what you do.
You know what's funny is the reason I picked my specialty is because I like the diagnosis and the treatment part's uninteresting. And to me, the way I see it is I diagnose it and then I send you to a specialist to go take care of the treatment part of it.
Right. Because the hard work has been done.
It's already been done.
Yeah. The hard stuff is diagnosis.
I feel like the way that I see it, and this is just because I'm an egomaniac, is like I'll see it as I am like the general contractor, and each of the specialists are a subcontractor for whatever I need.
Yeah, totally.
So like the urologist is my plumber, and the GI is like the other plumber, and cardiology is the electrician.
Yeah.
And so whatever the problem is that I've figured out for them,
That's great. I like that.
That's the way
I
I
really
see
like,
it.
and that's actually really true because, like we talked about in the first couple episodes, you're a doctor's doctor, and a real doctor cares about the holistic approach, which is what you always take with your patients, versus subspecialist. We're kind of like, all right, well, I fixed the problem. what are you still doing here?
Right. You want them to see them once or twice, fix it.
Yeah.
They say thank you, they're grateful, and they're out of your hair.
Right.
Yeah.
So what else did you think about before when you decided to
What's
do internal
funny
medicine?
is, so I was like a jock in high school, college. I played soccer, and I thought, also went to medical school thinking I wanted to do surgery of some kind.
Yeah.
Really ortho, I thought too. Also.
Yeah, that's so funny. Yeah.
And then I hated it. Because it was so, to me, the way. It's just very repetitive. It's like, the first time you see a knee replacement, you're sawing this and it's cool. But then the next patient comes in and you're sawing the same thing and then it's cool. And then it's like that times 1,000 times every day times your whole life.
Right.
And that lost interest for me. I like the variety. What I do is just, it's complete variety. So I see an 18-year-old kid. I see a 90-year-old lady. I see a 40-year-old this. Every single type of problem, from heart problem, lung problem, stroke, infections, everything you can think of.
Right.
And I like the breadth of I like knowing a little bit about a lot of things more than being an expert on one thing. You're a subspecialist of a subspecialist.
Super sub. Like I am the worst.
Yeah, we're like
clinician.
exactly the opposite.
We're exactly the opposite. Yeah. I'm literally the worst clinician in the world. People will come to me with medical stuff sometimes, and I'm like, huh? Even my wife will joke. She's like, oh, he's not a real doctor. Here, what's going on? Let me talk to you about it. And it's so true because I am such a craftsman now,
Right.
And like you said, like it's like the orthopedic surgeon, the knee surgery over and over. Right. I do the same surgery every single day, over and over and over, and I love it because it's like variances in each of the procedures. Like there's no nose that's the same.
Yeah.
And so I love the niche variances within the same procedure.
How can you tell what this is like all the things I always wonder. How can you tell what it's going to look like when you're still in there?
So this is like, kind of cliche, but really cool thing that when I was younger, one of my mentors said to me, it's like, when the old school, like 13, 14, 15th century sculptors were ever sculpting these amazing, like the Michelangelos, they always said that Michelangelo was always there. My job was to find him. Right. It's not like they took the stone and created Michelangelo. They had to find the stone that Michelangelo was in. And that's kind of cliche and corny, but it's kind of true. So when I see a nose, I kind of, because of experience now, I've done so many noses, I've done so many consults that I just know the anatomy. But you just know when the nose is going to come out good, and you just know when it's not. And if I know it's not going to come out good with my technique, I turn them away and I refer them to a doctor who can do a more reconstructive approach to it. But sometimes you see it and you're like, wow, you're going to get a great result.
So a lot of my friends who've listened to the first few episodes of the show kind of have asked me, what does it mean, scarless nose? So what are you doing? What does that mean?
Right. So there's two types of rhinoplasty. One's open rhinoplasty. You make a cut and lift up the hood of the nose and you can reconstruct it. It's a great approach for reconstruction. Okay. I kind of compare it to buying a home, tearing it down and demoing and rebuilding a home. Okay. Versus what I do is kind of like buying a home and remodeling. So I do what's called closed scarless rhinoplasty. We make cuts on the inside of the nostrils, and then we make little tiny incisions, and then we're operating through a 2mm tunnel, and we're just shaving, finessing, moving, replacing, just doing really minimal tweaks to it to kind of remodel the nose.
That's really cool.
Yeah.
Really
but
cool.
It is repetitive.
Are you using like looking through like a
loops? Yeah, I use magnified loops and literally operating through a 2mm tunnel. That's my entire life is through 2mm.
Wow.
Yeah. So it's the complete opposite.
I was going to make a joke about your sex life, but I decided not to.
Thank you. My wife appreciates it. So does my mom who listens.
Great. My mom's listening too, so that's great.
Hi, Mrs. Toll. That's amazing. Yeah, but I think a lot of medical students have hit us up and been asking us about how we picked our specialties.
So do you and your wife ever, because what I always am used to, this is just the reputation because I'm never in an operating room.
Yeah.
This is like from my medical school experience.
Yeah.
Was that the surgeon is always mean to the anesthesia because.
Oh, totally.
So for those of you who don't understand, so the anesthesiologist is doing this very complex thing, which is adjusting. Basically, they're looking at the vital signs of the patient, the heart rate, the blood pressure, and how conscious they are. And they are adjusting medications, fluids. If people like in a nose job, maybe less fluid shifts, but some of these complicated heart surgeries and stuff, it's crazy complicated. And these surgeons also egomaniacs, because they all are.
All of us.
When these fluid shifts happen, that could be their own fault. They nick something that's bleeding. The first thing they'll yell out is, give them more fluid, like they're yelling at anesthesia like it's their fault.
Totally.
So do you do that to your wife or not really?
Not at all. I mean, once in a while. I can't say I'd never do it, but once in a while. But generally speaking, I will say I'm probably one of the nicest surgeons in the world to their anesthesiologists. And it's because I want to keep a happy home life.
That makes sense.
The happy home life's important. But yeah, you're right. Anesthesiologists do take a lot of brunt of the blame. And then surgeons are egomaniacs, like you said. Like most doctors, I think are. But surgeons are, and another one of my mentors told me the reasons most surgeons are egomaniacs is because surgeons are like athletes or like rappers, where you go into the court or you go into the booth and you think you're the best. Because if you don't think you're the best, you shouldn't be in that operating room.
I think this about anyone doing anything complicated, like a high-powered lawyer, high-powered, in any specialty of doctor, you need to be confident in what you're doing, or else you're not going to do it well.
And if you truly don't think you're the best at what you're doing, just don't do it. Give it to somebody who does think they're the best, because that's who the patient deserves. So it's not. We're all egomaniacs. You included, me included.
Thank you.
It's not in a bad way. It's because we want to deliver the best results for our patients.
So
the other thing I saw was this article about a squirrel got the bubonic plague. Is the world ending? What is going on?
It's so crazy right now. So there's been plague now, like a few places in the world. I think there was some on the Mongolia-Russia border maybe, and now we have some plague in the US. This is like such a crazy year.
Killing squirrels in Colorado.
So the plague was this thing in like the medieval times that killed like half of Europe. The cool thing now is that, so the plague is actually a bacteria. It's called Yersinia. And something called doxycycline, which is like your run-of-the-mill, like we actually use it to treat acne, to treat skin infections.
Very common.
That will kill it.
Wow.
So bubonic plague now is a cool headline for CNN because people are going to be scared and want to clickbait, but it's actually very treatable now.
So is bubonic plague bigger deal than COVID?
No.
No, not even close. Okay.
COVID's getting very crazy right now.
COVID's scary crazy,
Our country really is not doing a good job.
I was going to say, do you think we're doing a phenomenal job?
It's terrible. It's really unbelievable.
How do we have more cases than Wuhan?
We have more cases than like the rest of the world. Florida has more cases than China.
You're right, which is impressive. It's very impressive. California's number one though, right? We have the highest number of cases.
I think Florida right now is the highest cases per day. Florida and Texas are both, like the hospitals are getting full. In California, I think Riverside's hospital, I hear, is full. Los Angeles, there's a lot of cases, but knock wood, so far the hospital capacity is still there.
Still there, okay, good.
But I'm on my testing, like I said, we're doing house calls and drive-through, and we're getting a higher positivity rate despite higher testing.
Oh, wow.
So what that means is the percentage of my positive tests is going up despite the fact that we're testing more.
What's the normal range?
So the range in various states, we want to keep it below 10% positivity. In Florida, I heard it was like above 20 now.
Wow.
I actually read some article today that over 1/3 of children, and so I don't know how big the sample size was, but they were testing children just to see the prevalence because they're thinking about opening schools. And 1/3 of the children they randomly tested were positive.
Oh my gosh.
It's crazy.
And it's about who they're going to come in contact with. Like imagine being a teacher.
So I'm having a lot of school districts call me about setting up like testing programs for them.
Wow.
And we have a few where we're going to plan to test every single person at the very beginning.
Yes.
And a lot of the schools are thinking about a strategy of like virtual week in and switching off.
Yeah, that's great.
And things like that to have less desks in the room. So anyway, that's the.
Oh my God, that's so scary. God bless the teachers.
Yeah.
God bless the doctors and the teachers.
God bless us all.
I know. God bless us all. This is a crazy time. But I do feel good that at least we know what a shutdown is now. We know that it's not going to be forever.
Yeah.
We know what we're going to do. You're going to be working.
And if anyone's out of work and has any medical background, I probably could use you for my testing business.
This is a call for a job search right now. Call Dr. Jeff Toll.
Yeah. We're ready for you.
That's amazing. All right, guys, and we are back with the one and only, the beautiful, the amazingly talented Arianny Celeste.
Oh, I thought you were talking about me. That was weird.
If you had less facial hair.
Thanks for coming on today.
Thank you so much.
We're super excited. So for our listeners who maybe don't know, most of you definitely do, Arianny is well known as the queen of the UFC fight world. She is, how many years were you involved with UFC?
I want to say about 14 years now.
Wow.
Yeah.
So you were what, like 6 years old when you started?
Yeah, pretty much.
Gotcha.
Pretty much.
All right, let's leave it at that. Yeah, you're 20 years old at this moment.
Yeah, never ask a woman her age.
Oh, I didn't.
Rule number 1.
So we're super excited because you are by far one of the most well-defined beauty icons in modern history. I mean, people are obsessed with you. You have literally people obsessed with you.
Oh,
and
thanks.
You know this. So now that you're pregnant, you've officially announced it, right?
Yeah.
No secrets being shared here.
No secrets.
Okay. So tell me, what has that changed? What's going on? Tell us about life.
Oh man, it's a whole new world, a whole new chapter. I'm very, very happy. I'm embracing this whole thing, pregnancy, motherhood. I've waited for this my whole life. So I'm super excited. I was very nervous initially, how people are going to respond and how people were going to take it. I've always been like this, going from the professional hot chick, as Joe Rogan says, to a mom, it's a big transition. So I was definitely nerve-wracking, telling everybody. But I have got nothing but love and support. There's been a few bad apples, but literally like a few, like I can count on my one hand, and all I do is block them. But like, it's just been a outpour of just love and support. And like, I feel like I've always wanted to be able to connect with women, to inspire them, like take care of yourself, be your own goddess, no matter what shape, size you are, and just embrace the inner goddess in you. And I feel like being a mom, it's just like you get into that club. You're like, oh, she's a mom too. And you guys can connect in that way and like talk about different things and support each other. I feel like I have so much support from people that I don't even know. So
wow.
It's
And
really
that leads me to my next question, because as you said, I never considered you the token hot girl. I just thought you were beautiful. But what is your definition of beauty now? And how has it changed, of course, from what it used to be?
Yeah, I think less is more. I think a lot of the women get tied up in that look, and it's beautiful, like the Kim K look.
Yeah,
I love it. It's beautiful.
We love you, Kim.
But I think she's gorgeous. But I think a lot of girls are changing themselves. I think they need to embrace their uniqueness, because we're all unique and different, and we're all beautiful in our own different ways. Tweaking here and there, definitely, but not overdoing it.
Amen.
Yeah.
I love it.
So I think, this may probably be a huge opportunity for you to sort of get a lot of new fans, women, people into health and family. And I think, that may be really exciting for you. So a lot of the women who probably are watching you and watching someone, become pregnant and have a kid, they'll probably be looking to you to ask, like, how the hell are you so fit right now during your pregnancy? What have you been doing exercise-wise? What have you been eating? Okay. I think a lot of women may have these questions. What do you have to tell them?
Yeah. Luckily, I've always been into fitness. Whoa, just kicked really hard.
Wow. How often does that happen?
Pretty often. The baby's very active. So it's a weird feeling, but it's cool knowing that everything's okay. As far as my fitness goes, COVID hit, the pandemic hit, and everything changed. I've always been like a workout queen. I love it. I love intense workouts. I love going to classes. I feel like the classes really like fuel me. I get really competitive, but this kind of forced me to slow down. Pregnancies, slow down, and finding just online classes, like even on Instagram, like going on and seeing, oh, this coach is doing a live at 12, it kind of makes you have to be there. So get out of bed, take a shower, get ready for your workout, hold yourself accountable. So that's why I really love the live workouts. And I've found different ones for different things, everything from yoga to like salsa, dancing, just moving your body. And I'm now in my 3rd trimester, which I feel like I'm put back to square one. The first trimester, I was super tired. I'm always used to being on the go, traveling, working out, all that. So it forced me to slow down. And that's kind of what I'm feeling now in the 3rd trimester. It's just like, listen to your body, be gentle with your body. But also if you wake up and you have like that spurt of energy, like take advantage of it. So I go and I'm like, around like 10, 11 is when I'm most alive. And I'm like, okay, I have to get some sort of movement in. So even if it's 20 minutes. So I've been trying to do that as much as possible. But honestly, now it's like maybe twice a week. Whereas before I got pregnant, I was working out 5 to 6 times a week.
Wow.
See, if
I just love it.
If I could get my patients to work out 20 minutes a day, I'd be very happy.
Yeah.
So it sounds like you're doing pretty well for yourself.
Thank you. I mean, it helps not only physically, but mentally. I think if people would just push themselves to feel that feeling of just like accomplishment, you get that natural endorphins.
This is a big, thing that we talk about on our show all the time about how mental health is such a big part of our physical health.
Yeah.
And so, it's really nice to hear you have that same mentality about, when you're working out, you feel better and your body responds and you physically are healthier.
Yeah.
And I like what you said, that you don't necessarily plan it out. Like every day I'm going to work out from this time. If you feel that spurt, you take advantage of it.
Yeah.
Because a lot of people get that spurt of energy and they totally let it go. They're just like, oh, I felt good for a minute. Now I'm back to myself.
Especially now in quarantine, it's hard to navigate. But if you kind of have like a like set schedule or like an idea of what you want to do, like, okay, Mondays I'm going to do yoga, Tuesdays I'm going to do the salsa class, Wednesdays I'm going to do weights. It helps you just stay on track.
Are you doing less vigorous workouts as you've progressed?
Definitely less vigorous and less weights.
Yeah.
Yeah.
And tell us a little bit about pregnancy during COVID. Because you're not alone. There are so many people.
Oh my gosh, there's so many girls that are pregnant now. I feel like I was pre-COVID, so pre-quarantine, so I'm proud of that.
Your child won't be a quarantine baby.
Yeah, it's been strange. It's definitely been nerve-wracking. I've had to coach myself mentally, like everything's gonna be okay. You're gonna be safe. You're healthy. Not to buy into the fear too much. So I've just tried to have a positive attitude. And I think meditating is a big help. And that's something that I started during this quarantine. I was asked to do a 21-day meditation challenge, the Deepak Chopra challenge. And it came at the best time possible. There's a group of like 20 girls. Every day we would do our meditation and we had to check in and say, okay, I did it and did my task. There was like a 15-minute task and then a 15-minute meditation. And it was also gave you something to do and held you accountable for your mentality. And that really helped. And I said, okay, I see a difference in my attitude and how I feel, and I'm going to continue this after. So now I do like vibration frequencies, chakras. I play those. And then I set my timer for 15 minutes and then I do my meditation.
Wow.
So I've made that like a habit and kind of like force myself, okay, this is my time. I wake up around 8. So I'm like, okay, I'm going to get my coffee, get my water, and then I'm going to meditate for 15 minutes. And then I'll check my phone. Then I'll check my emails. Because if you do it the other way, it's like, it's really messes with you.
When do you meditate, Jeff? Because Jeff also obviously...
like we were talking about earlier in the episode, I really do my meditation at night, right before bed. Yeah. It just gives me some peace to sort of turn my mind off. I think my days are very long and I'm working 14-hour days, 16-hour days because I'm seeing patients and running my business and stuff like that. So it just allows me to relax at the end of the day. But like I tell my patients, I think it's part of it is just respecting your own body and respecting your own mind, and you're giving yourself
respecting your time. Like, this is my time.
Exactly.
Yeah.
And so I think no matter what, for you, if it helped during pregnancy, that's great. But I tell everyone, it doesn't matter what stage of life you're in. If you're retired and you're doing nothing all day, sometimes that's even harder to take up 15 minutes out of your day. That's your time, because it seems like you have all day and you're not doing anything.
Yes, you're not
but
claiming
take that
it.
time and put it in your schedule, and know that you're worth those 15 minutes or 20 minutes.
Yeah, know your worth.
Yeah, you're worth the time to give to yourself to make yourself feel better. And so that's something that I give to myself and that I encourage everyone to sort of give to themselves. I'm going to get my colleague over here to start doing it too for his sleep.
I know. I'm going to text you in the morning to meditate with. I'm going to text you at night to meditate with now.
FaceTime on
All right,
that.
we're going to create a new mini meditation circle.
I'm down.
That's amazing. And tell me, so COVID pregnancy visits, have you been going into the doctor? Are you doing some virtual stuff?
So she does some virtual, but the ones that are necessary to see her, like blood work or whatever, I go in. Unfortunately, I can't have my partner with me, which kind of sucks, but, it is what it is. It's sad, but, I'm just thankful that we're healthy. We get to see her. I can get him on FaceTime if I want, and it's all good.
Yeah, you have such a positive mentality. Like, you just really have embraced knowing your worth. The things you said in the past 10 minutes, knowing your worth, claiming your time. I love the being your own goddess. Like, the way that you approach life is really so forward thinking. And I think during a time like this, I know a lot of people who are just, as we talked about, depressed, sad, have kind of clammed in. And especially if they're pregnant, they feel like, oh, how unlucky am I? I get pregnant, now I have to deal with COVID, woe is me. And you've just taken a completely different approach to it. And I love that.
And we haven't even talked about her new venture, which also during pregnancy she's managed to work on. So
thank you.
Yeah, so the girlfriend box, all the rave. It's all over Instagram. I'm seeing it everywhere. I'm seeing influencers posting about it. So tell us, girlfriend box, what is it and why is it?
So Girlfriend Box is a subscription box that a man can get for his girlfriend or wife. Obviously, women are welcome as well to give it to themselves or their girlfriends. It is a personalized gift box. So basically, you go in, you put in your dates, your special dates, anniversary, birthday, blah, blah, blah. It's locked in. You never have to forget a date again. We do all the work. You can say, my girl or my wife is boho, classic, or edgy. And then we kind of curate the box to match her style. And again, you guys never get in trouble. You never forget a date.
So it's not actually a girlfriend that comes in the box?
No. No. So if you don't have a girlfriend.
That would sell out.
But I do think this is a great idea. My brother's wife owns a jewelry company. And every year, my various ex-girlfriends can tell you that I'll forget, whatever, their birthday or the anniversary or whatever. And then I'll frantically text my brother's wife and be like, you got to get me some jewelry, like, immediately. And
nice to know.
Yeah. So this makes it a lot easier to,
Yeah.
You program it in and it's done.
Yeah, that's what we're here for. We're here to help you guys out.
And design-wise, what is your style? You just said bohemian. What's yours?
Mine is a little bit of everything, and that's why I went in and I picked the pieces that I would wear. So it is curated by myself, but you can personalize it to her style, and you can always change it too.
I love
Sounds
that.
amazing.
That's amazing.
Yeah.
We're both signing up today. I cannot wait. That's amazing.
Yeah.
What's been the hardest challenge during COVID for your business? Has it been a good thing for business?
It's good and bad. I've been around for the company has been around for 3 years now. So as I was doing the whole relaunch, everything, redoing the logo, the website, everything, that's right when the pandemic hit. So I think at first the uncertainty was like, oh my gosh, like, can we still do this? Can we still relaunch? Is it going to be successful? But then like everything was on Zoom and virtual. So it was like, okay, we can still do this. It's still happening. We're talking to the ambassadors virtually, like getting people on, getting people excited. And we just worked around it. And it's been great so far.
Wow.
Because it seems like retail in general is just like down, down, down. So all these kind of concepts, I mean, to me, it makes perfect sense. I'm sort of, both of us have found that this year we've done a lot of, consultations virtually. And there's just in the world today, it's less important to physically go somewhere. And so
and it's more convenient.
No, in general. So even if someone had to go to your store and you handed them the piece, this is even easier than that. It's they sign up, girlfriend gets the box. It's amazing.
Yeah. I mean, I can tell you personally, I have bought my wife so many gifts that she's returned, kept and not liked.
Yeah.
Kept and given away. I found out she sold a purse I gave her 10 years ago, just recently on Poshmark or something.
Oh, yeah.
I'm so lucky that my girlfriends aren't around long enough to ever know. So it's like, whatever.
I want to follow your wife on Poshmark. I want to see what she's selling.
Clearly not good stuff.
Aw.
So now when she gets her girlfriend box, she'll finally be happy.
Yeah.
Yeah, that's super exciting.
We found also that girls love jewelry no matter what style she is. Like, that was another problem. It's all about like learning, right? In business, what works, what doesn't. I was doing everything from packing boxes to packing, figuring out what items to put in, what dresses, what styles. And all girls are different. They all have different styles, but they all love jewelry. So, so it's been a winner so far.
You found that common theme. That's beautiful.
I think it's so amazing to hear that even yourself starting a business, we're like yourself doing all these things. I think a lot of, I get young doctors, like medical students who think about starting their own practice and they don't understand how hard it is. Like you have to grind out anything you're starting. So it's amazing to hear that you got to get it up. It's like pushing a boulder up a hill. You got to get it up. And then once you get it down the other side, it's a lot easier. But the getting it up
picks up after. Yeah, for sure.
Yeah, automation. Well, that's amazing. And so for people who are listening, because obviously your Instagram has changed, right? Now you're posting these beautiful pregnancy photos, which look amazing. And everyone's like, supportive and it's so beautiful. Post-pregnancy, what's your plan? And are you the type who are going to be really hard on yourself, or are you just going to let things fall into place again?
I'll probably be really hard on myself. I'm trying not to be. I'm very physically fit and I expect myself to push myself after. And that's not for everyone. People react differently to birth. And, I'm hoping for a beautiful birth that's not stressful and healthy, and I can recover really quickly and get right back into working out. Yeah. Because I also want to lead women like that. That's who I am. And hopefully it can inspire some women. Have you found that different brands are now interested in working with you? Because I imagine once you have a baby, then there's going to be all these brands that sell baby products and that are going to be dying to work with you. Dying to work with you. So I don't know if you guys have really thought about that, but I would imagine, now obviously all these fitness and sports brands want to work with you, but I imagine that'll be a complete change. So any thoughts about, would you want to do that? Are you going to think about having the baby in your photos and your Instagram, or is that something that you maybe wouldn't want to do? Oh, definitely. I want to show off the baby. Yeah. Not too much. I don't want the baby to have their own Instagram or anything, but I want to be proud of my baby and I want to show off motherhood, and it's a beautiful thing. It's even hard to explain if you're a man. I think if you're a woman, automatically you're like, yes, this is how we feel. No, it's very empowering in a crazy way. Like you're building a human in your body. It's nuts.
Crazy.
So I'm definitely going to embrace them. I hope to work with mommy brands. That's the whole goal. Like have a whole team they're helping me reach out to different mommy brands and stuff. I'm working on a product that is a mommy product for the skin. So, there's a lot of plans for that.
I love that. Yeah, because we were talking about, we want to do a segment on pregnancy during COVID, talk about it. And I said, we have to talk to Arianny. Like, there's no one better to bring this on. Because like you said, we can't comment on this. We're here to listen. And as a female goddess for your fans and followers, we want you to promote that strength. We can't do that.
Thank you. Thank you. Yeah, it's been a journey, but it's been beautiful. Honestly, I'm very thankful for the quarantine because, me and my man, we just like hang out, and I've been able to like just slow down and chill out and take care of myself and the baby. And
so it sounds like you've gotten a lot done. You've learned how to meditate. You've made a baby inside you.
You've been productive in quarantine.
Super productive.
Yeah. So last thing I want to ask you. So your body was definitely one of the most iconic parts of your life for the past 10 years, right?
Yeah.
And is that where you would say a lot of your confidence used to come from?
Definitely. I would say when I first started with UFC, I was very shy. I wasn't confident in my own body. That quickly changed when you walk around in an octagon with a bikini for so long. And the confidence grew with that. And then I did Playboy. That was like the turning point because I trained really, really hard before that to look my best, feel my best. And I just remember the day it was just like, yes, I got this. And then from there, it's just like, my body is my vessel. I always say that, like, my body is my vessel. I have to take care of it, have to honor it. I have to cherish it because, you only get one.
So it sounds like you're taking a holistic approach to the beauty of your body. You're not looking at it from a superficial standpoint where you're saying it had the perfect curves and that's why I feel good. Because honestly, I've known you for a while. You seem happier today. I mean, you've always been happy, but you seem so buoyantly happy. And so clearly it's not from the sex appeal of your body. It's the way you're taking care of it, it sounds like.
Yeah. Both physically and mentally. I've gone through a lot mentally. Like you said, taking care of your mentality is super important. I've done a lot of therapy. I've done ayahuasca. I've done like a lot of things to deal with my inside that I think now is like showing on the outside.
It's beautiful.
Yeah.
Beautiful. Thank you so much. This is so amazing. Thank you for sharing your journey with us.
Thank you.
So before we go, why don't you tell everyone how to find your girlfriend box?
So you can find Girlfriend Box on girlfriendbox.com. Our Instagram is Girlfriend Box. You can find me on Instagram, Twitter at Arianny Celeste, Facebook, The Real Arianny Celeste.
Fantastic. Thank you so much for joining us today.